And I'm really, really pleased to introduce Katha Fortier, who an RPN by training is the assistant to the president in charge of healthcare at Unifor, which represents more than 26,000 healthcare workers. She has a deep personal commitment to improving care levels, including conditions in long-term care, and has led within her union and in the labor and community movements to try to win these improvements. She has spent decades advocating for public health care, stopping privatization, improving funding and capacity in our public health hospitals and in all of healthcare. Katha, welcome.
Thank you, Dr. Oliveri, for your kind words. And I'm very pleased to join this panel tonight. And thank you to Natalie, of course, for organizing it. And for the hundreds of people who have shown up tonight. That really is, it gives me a sense of satisfaction knowing that there are so many of you here tonight sharing our message. You know, Canadians share an incredible pride over our publicly administered, publicly delivered healthcare system. The Canada Health Act is really sets us apart. We feel, that this is it's a very good feeling for Canadians to know that judge and janitor get the same healthcare when they need it, and it's based on need and not ability to pay. And the interesting thing is, people of every political stripe feel this way. If you talk to them about healthcare, most people understand this. We do know, though, it's clear that the biggest, most obvious failure of privatization is the long-term care system. Now, I can tell you, I can see some long-term care workers on this call tonight, and they knew this before the pandemic. But the pandemic, of course, exposed the horror of what was actually going on in long-term care homes, as people worked through a humanitarian crisis, just trying to keep the residents that they cared for alive. But the question might be is, how did we get here, and where did this start? We used to have a system in Ontario where most of the healthcare, the long-term care, was actually delivered publicly. It was delivered in municipal homes and charitable, not-for-profit homes, even hospitals. Hospitals had actually long-term care wings on them. They had, the residents with the most complex needs were in complex continuing care beds and cared for and given the actual care that they need in a hospital setting, but also that was geared for their living in long-term care. And they were cared for under that umbrella of the Canada Health Act. When Mike Harris was elected, and I'm sure there's probably several of you on this call tonight that remember the restructuring commission that rolled through Ontario and closed thousands and thousands of hospital beds. And in return, we were given thousands and thousands of long-term care beds built by for-profits. I would also remind people on the call that we're probably the only jurisdiction in Canada or the US that actually pays long-term care for-profit operators to build long-term care facilities that then become their assets. So, it is really a conundrum. This has been started by Mike Harris, who we know, of course, has found himself in a very profitable situation as the board chair of Chartwell, earning $250,000 a year for his part-time job, and also owning millions of dollars in stock. But this didn't happen. This happened by design, and we can see with this government and their close ties to the for-profit operators. We can see in their donations that they make. We can see in the beds that they award. Now, the Ford government's obviously very, very careful in their announcements of new beds. They rarely make a big production about giving a license to a for-profit operator, but they're doing it time and time again, and they're taking absolutely no advice on this. I believe that if the people on this call commit to working together and joining with our friends, because we know if there's 300 or 400 or 500 of us here, there's so many more that feel exactly the same way, that we can win this. And the way to win this is to defeat a government that is hell-bent on privatization of healthcare. As Natalie mentioned earlier, we see that our hospitals are now at risk, with comments by Minister Elliott a few weeks ago that largely haven't been reported in the press, but are very clear. Her words are very clear. We will have private hospitals. And particularly, we need to send the message that that's not acceptable, that we've got to walk back privatization in long-term care. We've got to walk it back in home care, and we've got to prevent our hospitals from being privatized and those services being privatized any further. So thank you, everybody, for coming tonight, and solidarity. I know we can do this. Thanks.